News.
Now, the Department of Health has commissioned the world's biggest study into the effects of mobile phones' radio waves on children's brains. The study will examine around 2,500 school children, ages of 11 and 12, assess them then 2 years later on functions such as memory and attention. Last official advice, that was some 9 years ago, suggested that as a precaution, children under 8, for example, should not be using mobile phones at all. Well, with me is Professor Paul Elliott, who's Director of the Centre for Environment and Health at Imperial College London, who's an investigator on the study. And thank you so much for coming in. What's the purpose of this, and should people be alarmed even by the mere mention of this study?
Well, the purpose is that actually a lot of the research that's been done on mobile phones has been in adults, and particularly focusing on risk of brain cancers and things like that. Whereas this is focusing on children as they go into secondary school, when they start, essentially the majority then get a phone. And so the idea is not looking at cancers and things like that, but looking at the way children think, their cognitive skills, and whether the use of the phone, you mentioned radio waves, that's one aspect, but there's also the way the children use the phone for gaming, for going on the internet, also for work, and how that may affect their transition at this very important stage of their learning.
I mentioned 2,500 there. How do you select them? How are they included?
So we've actually written today to 160 schools around London, and the idea is to recruit schools and then children within their schools, and also, of course, their parents.
And within that, then, will you look for children who are known to be very dependent on mobile phones, or will you just take a broader cross-section of people with varying degrees of use?
It's absolutely a cross-section, because the idea is that you really need heavy users and lighter users, and you look at whether the amount of use and the way they use the phone affects their transitions. I say the cognitive test that we do at age 11 or 12, and then how they perform 2 years later. And we need to put all that together and try and unpick the effect of the behavioural use, the effect of the radio waves, etc.
There'll be lots of parents watching, and it's a pretty fair bet that they'll be asking, you're doing this because you think there is a problem. I mean, clearly, you wouldn't be using up all these resources and putting so much into this unless you think there's a potential problem there.
So the answer to that is definitely no. What we're doing is filling a gap in the research, so that with the results of our research, that there will be evidence to support the policies that will be developed for children at this age as they enter school.
When we talk about use, I mean, this is another thing that lots of parents talk about, which is that it depends as well, not just on the intensity, but when mobile phones are being accessed. Late at night, for example, in bed, looking at bright screens, all of that kind of impact on memory and the ability to concentrate. I'm assuming that's part of it.
Absolutely. So we're going to be looking at how and when children use the phone. And you're right, if children are taking the phone to bed and they're doing social media in the middle of the night, they're not sleeping, that may affect their attentional skills. They may be tired at school. But equally, if they're using the phone a lot, and they may be honing some of their skills. So we need to look at both sides of this.
When will I mentioned the 2-year thing, but when are you going to be in a position, do you think, to say something fairly conclusive about patterns of use and the impact?
So the research is for 3 years, starting now, and then we obviously have to write up the results of research. So I think we'll be coming back in 3 or 4 years' time to give you the results.
But the results really will be of interest not just to people in the UK, but there are global implications, simply because in 3 years' time, mobile phone use will be even greater than it is now, and it's already kind of blanket coverage.
Yes, absolutely. So this is the world's largest study to address this question, and I think the results will definitely be of great interest internationally as well as nationally.
Professor Paul Elliott, good to talk to you, and we can talk to you about the results hopefully as well. Thank you very much.
Thanks very much.
Thanks a lot. Professor Paul Elliott there of Imperial College London. Now, 2 inmates have